Well, good morning, good afternoon, good evening to all of our participants. Really excited to start this panel discussion on health tech investing with my esteemed panelists. Joined by Jenny Yip, who's managing partner of Adjuvant Capital, which is a life science investment fund dedicated to late stage research and development of products addressing significant gaps. She joins us from San Francisco. Also Sapna Shah, who's a partner at Novastar Ventures, a leading venture capital firm based in Nairobi. Originally born and raised in Kenya, spent some time in England before returning to her roots. Is also focused on health tech as part of her portfolio. And then finally, Michael Jelinske, who's associate director and a member of the global healthcare team at LeapFrog, which is a key partner of IFC's and focused on emerging markets and impact investing in financial services and healthcare with a focus on Africa and Asia. So all interested and capable people. Before we turn it over to the panel and get questions, I thought I'd spend a little bit of time about what the TechEmerge process really is. It's really a concept developed by IFC to act as a business development tool for both us for our own direct investments, but also through like-minded partners like Adjuvant and Novastar and LeapFrog. Really, we're matching global innovators to a real true market need in emerging markets. In this case, East Africa healthcare, focused on Kenya, Ethiopia, and Uganda, with the goal of not only helping come up with innovative solutions to meet the needs in those local markets, but hopefully create an investment opportunity in some of those winners. Then scale those solutions, not just in East Africa, but across 160 countries, leveraging both the IFC team and our ability to unlock regulatory bottlenecks through our colleagues at the World Bank to allow growth. A great example of this process is really in India. We invested in an online pharmacy business that really wanted to get into AI-based digital diagnostics to extend their reach from urban physicians to tier 3, tier 4, tier 5 rural Indian cities. With the help of our World Bank colleagues, we're able, in the midst of COVID, to change the regulation to make telemedicine permissible and legal for online prescriptions. So a patient could actually fill out a form. An AI-based solution could provide a physician in Mumbai with the 3 likely conditions that patient has. The physician makes the call on which of those 3 it is. Prescriptions automatically filled and delivered in rural India 24 hours later to treat the affliction. And that's really the opportunity we're talking about today, which is, and not to use a pun of Michael's firm, but is there an opportunity as an investors in health tech to truly leapfrog what developed markets, systems, infrastructure, and processes have been, that actually become an inhibitor and resist change, to actually create a situation where coverage is much more diverse and at a much lower price point, particularly in markets that don't benefit from the equivalent of government guaranteed payments or insurance companies. And it's really, as Michael suggests, more of a consumer-driven choice. You know, it was just 2 years ago that the US FDA first approved its first AI-based diagnostic device, which was based out of the University of Iowa, called IDX, to diagnose diabetic retinopathy. And much has changed in the 2 years since that first FDA approval in terms of advances in how tech and healthcare come together to create solutions. IFC is very, very interested in this investment field. We just recently had board approval for a $2 billion global healthcare platform with the goal of mobilizing from partners like Novastar and LeapFrog and Adjuvant an additional $2 billion of investment alongside us, not just in connection with COVID, but in long term in solving the strategic development goals of providing quality healthcare at an affordable price. With that, maybe we can start officially the panel. And I'll start with a question from Jenny. I know it's early morning your time, so you may not even have had coffee yet. But you invest in some very interesting business models, typically pre-FDA approval or regulatory approval in the context of biology. when you think of COVID-19 and interventions that you've made, where you've made several investments kind of in reaction or in relation to the advent of the contagion in the pandemic, can you tell me a little bit about those and what you're thinking?
Sure. Thanks, Bill. And thanks, everybody. So Adjuvant Capital is a dedicated global health investment fund. As Bill mentioned, we tend to invest in companies that have mid to late clinical stage product research and development for drugs, vaccines, diagnostics, and medical devices. We solely focus on high burden and infectious disease, COVID-19, of course, being one of them, and also sexual and reproductive health. So the way that we think about COVID is we're not necessarily just targeting COVID, or our portfolio companies aren't just targeting one single disease. We often think about a portfolio approach at the portfolio company level and also even at the individual company level, where you can have multiple disease indications. So with COVID or other respiratory viruses, we think about it as a platform. So regardless if it's a diagnostics company that has an AI-enabled diagnostic test, COVID is one application of that technology, and potentially a first very rapidly evolving application of that technology, where you can use that to perhaps pave way with regulatory authorities, distribution channels, sales and marketing, and whatnot. And so we think about this as a long-term play. COVID might have accelerated the growth and development of an early stage company, but it's really kind of COVID and all the other applications for infectious disease, and most relevant for whether it's sub-Saharan Africa, South Asia, et cetera, that we are investing behind.
Thank you, Jenny. I should mention to the audience that the Q&A feature on Zoom is open, and we want to make sure that these esteemed panelists have the ability to answer any of your questions. So feel free to input any questions as we proceed through the next 50 minutes of today's discussion. I'm going to turn to Michael. So beyond the pandemic, let's move forward and assume we solve this. We've seen in previous pandemics, whether it was SARS or Ebola, there's implications to healthcare that far outweigh just this disease itself. We know from Ebola and SARS, maternal and child healthcare got dramatically impacted and set that back by 5 to 10 years. We know that there's an impact on HIV and AIDS as a result of the distraction of people focused on the COVID vaccine and malaria and solving that challenge. But when you think going forward, what are the thematic, as an investor that thinks long-term, what are the thematic areas that you think are most promising at LeapFrog to invest in health tech? And in a related question, we see a lot of platforms and a lot of businesses that are now embedding finance into their business model. Is there an opportunity for health tech and fintech to converge?
Great question, Bill. In terms of thematic areas, outside of the pandemic, we still see a number of trends and tailwinds across the markets that we invest in. I can highlight 3 of these. First, we're still seeing a continued shift in disease burden to non-communicable diseases. So NCDs like cancer and cardiovascular disease, they're still projected to be the top killers in Africa over the next 10 years. And currently account for something like 50% of the deaths on average. There's also a distinct link with COVID. Death rates tend to be 12 times higher for coronavirus patients with chronic illnesses than for others who become infected. So this is all driving the need for better chronic care management and more specialist care, as opposed to some of the more traditional generalist offerings that we've seen. And so this is a reason why we like single specialty providers and healthcare technology platforms that do work to address this challenge. Second, we're seeing an increased focus on more holistic and preventative care, focused more on the consumer. So we're looking at new, more efficient delivery models to reach patients at an early intervention stage to help them kind of triage. It can reduce costs and also increase a lot of accessibility. So this means more touch points outside of the hospital for more convenient on-the-go care, and lends itself to areas like retail pharmacies, diagnostics, and also healthcare technology. Last, we're also seeing still strong long-term macro tailwinds. although these are likely going to be tempered, at least in the near term. So many of our markets are seeing, burgeoning populations, rapidly expanding economies, and rising incomes. On your question on embedding finance, I think there is going to be some convergence between healthcare and fintech. For instance, for technology solutions for payers that look to, introduce transparency and cost efficiency to health financing, or even providers, looking at ways not only for electronic medical records and whatnot, but also for administration and financial management of the actual hospital. I think that those are ways that the two might actually come together in the, looking outward.
Thank you, Michael. Sapna, I'm going to go to Africa for this question, since that's the focus of this conference. So as you know, Africa is home to 11% of the global population. It's the fastest growing in terms of population as a continent anywhere in the world, but it still carries 25% of the global disease burden, which is a challenge. Many of the countries in Africa have over half their population. Ethiopia is a perfect example, living in rural areas with limited access to healthcare. There's no infrastructure. There are no hospitals being built, and people, if they're sick, have to travel a long way to seek care. However, Africa pre-COVID was, starting to show very strong signs of economic growth and new people moving into the middle class from lower income. Obviously, it's hitting its first recession as a result of COVID in a long period of time, and probably the most severe in several decades. At the same time, our colleagues at the World Bank and many countries in the African Union are calling for universal health care, while fiscal budgets are being strained to the max. How does Novastar look at some of these themes and opportunities and factors, and how does that play into how you think about investment decision making? And what do you see are the most promising health tech investment trends and opportunities in Africa over the next 1 to 3 years?
Sure. Thanks a lot, Bill. And thanks for everyone who's on the call today for dialing in. Bill, let me just start with sort of the question or thinking around the universal health coverage and some of the other trends that you mentioned, which, despite the fact that right now some of that might be slowed down, overall the tailwinds are in our favor. And you mentioned this in your introduction, Bill. So one of the biggest barriers to universal sort of health coverage on the continent is that majority of the people right now have to pay out of pocket for their healthcare needs. There's not enough insurance coverage for people, unlike the rest of the world. And governments are realizing that they can play that role as the payer. Of course, insurance companies, microinsurance companies as well, but the governments could have the largest impact there. But they also realize that it's going to be difficult for them to play the role as the provider. And so there is a lot of opportunity for partnership between private sector that has figured out how to actually provide the healthcare at a low cost, in an efficient way, and in an innovative way that actually listens to their patients and their customers, to partner with governments. So specifically in the healthcare space, we think that there is opportunity there. Maybe just a little bit of background in terms of how we view investments in general at Novastar. We're a venture firm. And so we really believe in sort of the idea that entrepreneurs will be able to solve big problems because they're the ones that can be innovative and disruptive. But it's only once they've been able to prove that what they're doing works, will they be able to really partner with government. It's very difficult to sort of come in with a shiny solution and go straight to the government. So being able to prove that it works in a private setting then enables partnership with government. Bill, your question around what do we see as some of the trends over the next sort of couple of years, and we we really think that technology on its own in the next few years is not going to solve the problems of healthcare for the masses. It might for the middle and upper income here on the continent, but not for the masses, because at the end of the day, majority of the people still will need to visit some sort of bricks and mortar clinic, pharmacy, shop to get their healthcare needs. And so companies that are able to combine both healthcare infrastructure, bricks and mortar, as well as technology to make that efficient and to be able to scale is exciting. We've got 2 investments in that space already, Penda and M-Pharma. Another example of a company that is exciting right now is, use technology and sort of think like a platform to leverage underutilized clinical officers and have them go to patients' homes right now, because people don't want to go to hospitals during COVID for those visits, and have technology to help them do that. So that's how we're looking at healthcare investments in the next couple of years.
Thank you, Sapna. It's interesting. We're seeing this trend of at-home healthcare versus the bricks and mortar, go to a clinic or a hospital, taking off in a lot of emerging markets. And it may be because of COVID, but it may actually be a lasting business model that allows for deflationary costs, because you don't need the same amount of infrastructure to be built.
Exactly.
Jenny, I want to come back to you with a question. You recently made an investment. It wasn't in East Africa. It was in West Africa, in Nigeria, and a business that hopefully, I think, aspirationally wants to cover East Africa, which was 54Gene, which was started by an interesting entrepreneur who had the view that there was a ton of DNA being used in biotech from Caucasians, Chinese, and Indians. But there was really a dearth of African DNA, even though it's some of the most genetic diverse on the planet. Tell us about the rationale and why you thought about making that investment, and how you're thinking about helping the company go forward.
Yeah, absolutely. It's one of our proudest investments, and I personally was very, very intimately involved. And I understand Abbasi was actually on an earlier panel as well, so I hope I'm doing his justice by describing his company. But anyways, going back to kind of Adjuvant's mission, we believe in increasing healthcare access and health equity for all. And so if you take that 100,000-foot mission statement of Adjuvant and take the 100,000-foot mission statement of 54Gene, it actually matches really, really well. And so from Adjuvant's perspective, if we're thinking constantly about drug vaccine discovery for populations, regardless of where you are, and we want to increase the chances that these drugs and vaccines are not only relevant for people in the US, but relevant and applicable for everyone in the world, the premise of 54Gene and the power of that technology goes really well into our investment thesis. And more specifically, when you're talking about infectious disease or even sometimes non-communicable diseases, sometimes the negative filter is a very helpful exercise in drug discovery. So let's just use as an example, you're able to somehow have samples in phenotypic and genotypic data for infertility as a genomic marker. If you can then turn that around and create a potential contraceptive that is non-hormonal, because you have that information from a biobank to enable some of that drug discovery, that is one way, and one very specific way, that a company like 54Gene and Abbasi can contribute to Adjuvant's mission and Adjuvant's investment thesis. And then all in all, even beyond that, we think often about investing in diverse teams, diverse geographies. Oftentimes we think innovation only happens in San Francisco or Boston, but that is just simply not true. We think innovation is global, whether it's early stage innovation or even business model innovation.
It's interesting, Jenny, because much has been written and researched about why certain subpopulation of Kenyan women are immune from catching HIV/AIDS. With the work of something like 54Gene, we may actually be able to find what that component is and lead to, instead of treatment, a cure. So it's interesting. So I'm going to ask a question, and anyone on the panel, feel free to jump in. But, we've got the COVID crisis. At the same time, as I mentioned in my opening remarks, we have governments, particularly in emerging markets, showing more innovation on regulatory policy than we ever have in terms of flexibility while still trying to focus on privacy and other key aspects of regulation. They're showing a lot more flexibility because of COVID. We're also seeing a lot of behavior change. I think it was mentioned, at-home healthcare versus going to hospitals as an example. People now accepting delivery of drugs as opposed to having to go out and go to an actual pharmacy to buy them. We talk about Nirvana, which is universal health at a very low price point in Africa. Do you think this crisis actually has a silver lining and it's like the catalyst that's going to help accelerate that change to get to that leapfrogging ideal healthcare delivery model on the continent? Who wants to take that?
I guess I could start, Bill. I would say potentially. On the positive front, I think we've really seen a step change in technology and digital penetration. So, digitization of healthcare tools and proliferation of e-commerce, it's well underway. And mobile and internet penetration continues to expand, and it's already at quite high levels across the continent. For example, our pharmacy business, Good Life Pharmacies in East Africa, recently launched an e-commerce and delivery platform to actually get closer to the customer and be able to provide them with medicines in the middle of this pandemic. That said, I think the jury is still out on platforms like telehealth. I think one of the challenges that we've seen, at least, is their ability to really gain scale and traction and ensure that the businesses are sustainable. Yes, consumers are more open to new models of care. However, partnerships with insurance providers or employers or large healthcare networks are often quite key.
Thank you. Anyone else have a point of view on that question? Sapna, since you're in Africa.
One of the biggest challenges in terms of consumer behavior is the lack of trust in the healthcare system. Low-income consumers too often end up going to the mom and pop quack doctor around the corner and are overcharged and not diagnosed properly and feel worse. So they don't trust the healthcare system. And that's perhaps what COVID-19 will do is sort of increase the number of channels available to them. But as Michael was saying, telehealth on its own doesn't improve that trust factor. And you remember, people are making the decision around, should I spend this money to sort of feel better or pay for my kids' school fees, right? So I think one thing that really enables trust in these markets is the ability for a trusted machine to tell you whether something is wrong or not, rather than an individual, because an individual will lie because they want to make money off you. And so if there is an increase from a technology perspective in terms of low-cost at-home devices to be able to do certain tests, I think there will be an increase in trust and a change in consumer behavior. But without that, I think you'll still see a lot of people seeking bricks and mortar healthcare when they're not well.
It's interesting you say that because we're working on a big project to embed blockchain for an eventual vaccine for COVID for Africa, because so much of the pharmaceuticals that are sold are fake on the continent. That it breaks down the trust. So how do we actually create a system that increases trust? I'm going to go, Jenny, I'm going to ask you this question because you're in San Francisco. So we have big platforms, the Googles and Apples, that are investing billions of dollars in R&D on health-related applications. Well, at the same time, IFC and all of you are thinking about entrepreneurs that have great ideas and wanting them to succeed, particularly in a local context from emerging markets perspective. Is there a way for them to partner, or is it a winner-take-all opportunity as technology and healthcare intersect more and more down the road?
I don't think this is a winner takes all type of moment. I think even for the likes of Google and Amazon and Apple, who are the behemoths of the world, they still need local partners and still need local knowledge to be able to do whatever they need to do. And I think the tech companies know that, by the way. They know how important some of these quote unquote emerging markets are, which is what Americans say all the time. But I think this is going to be a trend going forward, that you have to have local knowledge. And then on top of that, I think there's specific ways to partner. Even if it's companies like 54Gene or others in our portfolio, we're constantly trying to help our portfolio companies make those connections to those big tech companies, whether it's just a partnership or perhaps a venture arm of some of these larger tech companies. This is what we try to do and help them make those connections.
Thank you, Jenny. Michael, I'm going to go to you for a question. So you invest in Africa, but you also invest in Asia. How do you think about risk return, hold period, opportunity as you're thinking about portfolio construction and deciding to do a health investment in Vietnam versus India versus, Kenya? How do you factor in the different aspects of those markets?
Yeah, I think we generally take the same approach and expect the same returns across all the markets that we invest in. So we are a global emerging market investor. I would say one of the benefits that we have in looking at all these different markets is we're able to take a lot of the learnings from one industry in one country and apply that to other investments in other countries. So for instance, our retail pharmacy chain in Kenya and in Uganda, Good Life, we've been able to take a lot of learnings from that and apply them to looking at retail pharmacies across Vietnam, Indonesia, Philippines, which can kind of give us an edge and allow us to even help the business in terms of our value creation initiatives after we actually do the investment.
Great. And Jenny, you invest globally. So how do you think about the risk reward balance between making an investment in the US versus in Nigeria?
Yeah, we think about that all the time. Look, I think we also take a similar approach across our portfolio companies, whether it's in different geographies or different products. Because yes, of course, investing in Boston versus Lagos is very, very different, but so is investing in an early stage small molecule drug versus a medical device for postpartum hemorrhaging. So when we think about our investment risk reward trade-off, we use just kind of first principles in investing. If this is going to be a lower risk, we can perhaps tolerate a lower return. And if it's higher risk, then we're looking for more like venture-like returns. But going back to your question about just different geographies, we assess risk in the context of that actual portfolio company or the prospective portfolio company. So if it's clinical risk that we're taking on because it's an early stage biotech in San Francisco, or regulatory risk if we're talking about a company that's based in Geneva looking for a CE mark, that's how we think about it. Very fundamentals-based research.
Great, thank you. I just reiterate to the audience, if you have any questions of our panelists, please type it into the chat function as we get to the second half of today's panel.
Bill,
So I was gonna, yeah, sure, please. I was gonna ask you a question anyway, Sapna, but please jump in.
So we can't compare between investing in Africa and elsewhere in the world because we invest in East Africa, Nigeria, and Ghana. But one of the things that we have learned, we've been investing in this market since 2014, so 6 years. It just takes longer, and it's not just in healthcare or health tech, it's in all sectors. It will just take longer sort of to see these companies sort of flourish than it probably will elsewhere in the world. And one of the reasons is that the rest of the value chain in the sector that they operate in lots of cases is broken. So these companies end up having to do a lot more than they had planned to do or intended to do to be able to solve the problem. So it's difficult, in Silicon Valley, you can say, I'm just solving this problem with this technology, and they can do really well because there's other things around it that are enablers. Whereas the companies we invest in many cases, have to do those other things.
I was going to ask you to give me a specific example.
Yeah, so sure. If you take, so we invest across sectors, not just healthcare, but if you take Penta Health as an example, they started off just with a couple of services, thinking we'll provide healthcare just to moms, maternal healthcare. Realize that that doesn't work because there's nobody else providing healthcare to the rest of the family. So you actually need to provide healthcare to the whole family, which is not that much of a stretch. You then realize that it's not just about providing the doctor services. You have to do more. You have to provide laboratory services because nearby there isn't a lab that you can trust to get accurate tests. You have to also provide drug services. Again, same problem. If you're not next to a Good Life or a Holton's or something, right? So it's just, you start off saying, I want to solve this one problem, but realize you have to do a lot more than you planned. And that takes a lot more capital and it takes longer.
That's a good answer. So I want to ask each of our panelists a question. I think all three of you have been to East Africa. I know Sapna is there because she lives there. But in the TechEmerge process, we spent a lot of time with private sector hospitals, clinics, and other healthcare physicians and participants to find out what they thought the biggest needs are. When I ask each of you, and Sapna may actually have the most relevant answer, what's missing? What's the greatest need as a participant, as an outsider looking in, or an insider living in Nairobi? And it's true for you, Michael, since that's where you're heading to in a couple of weeks. What's missing? If you were an entrepreneur as opposed to an investor, what business would you create?
I guess I could start. Maybe I could back up. I think one of the biggest obstacles that entrepreneurs often have is getting the product market fit right. Does the platform solve a key pain point for the customer? Is it priced effectively? All of those types of things. And so if you kind of scan the healthcare landscape in East Africa and try to understand where are those pain points, that's the first place that I would look to see if there could be a solution that one could actually build something off of. There's still, still challenges within the supply chain. So there's a number of new technology platforms that are, cropping up, trying to solve that challenge. There still is this challenge between most of the care being provided in urban centers versus rural communities. So thinking through different platforms like telehealth that could potentially enable that. There's a lot, but I think thinking about that product market fit and does it solve that pain point and can it be sustainable is probably the top priority I would look at.
Thank you. Sapna?
Bill, just to add to that, to what Michael said, we sort of have seen interesting technologies, devices that entrepreneurs are developing, maybe on the continent, maybe outside for the continent. But one of the things that they do struggle with is if they're not based here, how do they really test it for the local setting? And make sure that it is right for the consumer here or the consumer that they're targeting. And even if they are based here, having strong enough partners through which they can test it. So what you guys are doing in this program is part way to solve that, right? And up till now, there hasn't been strong enough partners to say, you know what, that's an interesting technology. We have access to thousands of patients. Here we are. You can sort of experiment with our patient network. That is something that is missing.
So it's an interesting question. I mean, I'll go get Jenny's answer, but then I'll come back and ask the panelists a follow-on. Jenny, what business would you create if you decided to, instead of invest, become the CEO of your new business in Africa?
This might be, I'm a hammer looking for a nail type of answer. But look, I think I have been really, really impressed with, the innovation that is actually happening on continent. And so I tend to think about what's next in the next 5 to 10 years, because that's sometimes how long clinical development takes. But I would start thinking about setting up biotech hubs in places like East Africa or West Africa. There is a lot of talent there, and a lot of passionate young to mid-level to senior level scientists that can truly be creating innovations for the populations that they are in, as opposed to somebody like me sitting in San Francisco trying to anticipate what needs will be in 5 to 10 years.
Thanks, Jenny. It's interesting because we saw that through COVID with the supply chains disrupted, and almost all the generics that go into Africa come from India or China, and you wonder why. Forget about biotech. Why not manufacturing generic pharma in Nairobi or Uganda or Ethiopia? It seemed like it would be a useful purpose to onshore those supply chains. Early on, I think we talked, and I think it was Sapna talked about the importance of public-private partnerships, particularly in the context of this, continued migration towards universal health coverage. That means that innovators, so entrepreneurs that are creating unique, healthcare technologies, whether they're in Africa or in Asia or they're in Latin America or in the U.S., have to think about how they integrate their invention, their innovation into an existing system. Is that a major challenge to figure out how to do that across multiple countries? And if it is there something IFC and the World Bank Group can do to help make that a smoother process? Who wants to tackle that one? Michael?
Yeah, that's a good question, and I don't know if I have a very strong answer to it. Of course, there's going to be challenges with technology integration, and I think it's a lot of businesses have their own systems, such as SAP or Oracle or whatever kind of back-end system that they use, and sometimes they have to integrate with some point of sale system or healthcare technology to actually be able to communicate effectively. I'm not quite sure if the IFC, I know the IFC does have consultancy and advisory services. One area where I think there tends to be integration issues is the ability to actually get the systems to talk to one another. So technical experts are often very much needed to be able to kind of phase that rollout or that implementation effectively, so it can happen in a timely manner. So if the IFC could provide support there, I think that could be an interesting way forward.
Great, thank you. Another question from the audience that came from the audience is really about blockchain and artificial intelligence. Obviously, important words that people throw around all the time, but we're at that, as we just talked about just 2 years ago, the first FDA approved use of AI in healthcare. AI is no longer that cool. It's just a simple tool to automate and use data that's being collected to improve decision-making and processes. Is there a unique opportunity in Africa, given the rapid digitization of society, given that it's a continent that it's going to kind of leapfrog in terms of, I sit in the US and I have a passport, a driver's license, an insurance card, 20 credit cards and debit cards, where, in the case of many countries in Africa, going straight to a digital ID with biometrics and a 14-digit number that now create a source of data with electronic medical records, with the right privacy regulations in place to truly have a unique data source to improve healthcare outcomes. Is that possible in East Africa? And I mentioned blockchain on, the vaccine ultimate delivery in Africa, but it could apply to all pharmaceuticals going into the continent or into East Africa. What are the panelists' views on the incorporation and acceleration of machine learning and AI into lower cost healthcare in East Africa?
So, Bill, I'm not an expert on AI, machine learning, blockchain, but from my understanding, what is absolutely needed to start off with is having good quality data to feed into the models that you want to build. And that is a huge problem on the continent. There's government clinics which provide a lot of the healthcare that are paper-based, right? So how do you access that? There's private, expensive private clinics that are paper-based. I mean, I pay a lot of money to see the doctor and they can't find my file and it's in a drawer somewhere, right? So accessing that data to start off with is a huge problem. And how do you do that? EMRs, as an example, is the first step, electronic medical records, etc. But I don't think adoption is fast enough. And so that's one of the areas, if somebody can crack, that's, I think, the foundation that we need for some of this other stuff.
Yeah. And I might add on to that, Sapna. One of the big barriers that we've seen, at least in pushing that data integration forward, I think has been a cost. It's been very cost prohibitive. A lot of these large systems that you see in developed markets tend to be extremely expensive, and these smaller clinics and even larger hospital systems can't necessarily afford it. So the actual data or software system that is put in place often needs to be priced correctly for the market. That's one of the most important things.
Sounds like a new business opportunity for you being an entrepreneur, Michael.
Yeah, potentially.
Jenny?
Bill, sorry, we are seeing a few more entrepreneurs and businesses that are coming in with sort of light electronic medical record systems and things like that that are enabled by the mobile or cheap tablets for this market in particular.
Yeah.
Yeah, the only other thing I'd add is I'm also not an expert in AI or blockchain, but for the companies that I've been exposed to, I think the data problem is very, very real. But at the same time, I think entrepreneurs and CEOs recognize that the potential for blockchain and AI and all those things could be really, really powerful. And if you're collecting data or amassing data with the idea and the anticipation of using blockchain and AI, you may actually be able to architect your data in such a way to take advantage of that in the future.
Agree with that, Jenny. Last, I thought I would turn it over to our panelists to ask me, the moderator, any questions they have about IFC. I know we've been in discussions and partners with all of you in different ways. What should we be doing better in how we're approaching the opportunities in healthcare and health tech investments in East Africa?
I'll start. I think for me, the IFC is not only a wonderful partner of Adjuvant, but the ability and the insights that you have globally as to what best practices are, whether it's business models, regulatory frameworks, political risk, everything, scale up everything. And to be able to help, not only fund managers like us, but really our CEOs at the end of the day to better connect and to share those things in a smaller group setting would be really, really helpful, because the insight that you have and at both the highest level and at the detailed level is completely different from anybody else that we know.
Well, great. Well, that sounds like we should have a convening on health tech with our partners. Sapna, what should we be doing better to help people in Kenya, Uganda, Ethiopia?
This is not just about the IFC. I think this is the sort of whole capital ladder on the continent. We sort of are seeing sort of more interest and more coming in earlier stage into investing into businesses where, it's a small ticket that businesses are still trying to figure things out. And then there is sort of all the large private equity players of the continent that will invest $10 million, $15 million, into something that's proven and it needs to be scaled. There's a missing part in the middle where companies are actually doing really well, but they need to raise $5 million, $7 million. And having enough players that are still willing to take the risk, I would say it's sort of growth venture. It's not steady yet, but there's a lot of promise. And having more players in that space would be really useful for entrepreneurs.
Thank you, Sapna. It's something near to my heart is to really create the full suite of entrepreneurship ecosystem and funding opportunities across all three of these countries that we're talking about today, but really across the whole continent, including fragile conflict states. Michael?
Yeah, it's a good question.
LeapFrog's perspective of what we should be doing differently.
We've had some, wonderful interactions with the IFC team. I think the whole firm does incredible work and has supported a number of our portfolio companies. I think the IFC does a very good job of taking a commercial approach to things in terms of looking at the investments that they make. I think there is potential to assist companies, as Sapna was saying, that may not have some of this access. Some of the businesses that you've invested in with us, they do have an institutional provider behind them. And they are a little bit further along in their life cycle as a company. So if there are ways to kind of look towards the earlier stage and see if there are ways that the IFC can support those businesses, I think that would be very helpful for the ecosystem.
Great. And then we'll close, unless there's other questions from the audience, with one question, since we have a bunch of entrepreneurs. Actually, we got one more question in. We'll take from the audience before the closing question. Question is, as the case with most tech companies, they take a while to break even due to the continued R&D expense and tech infrastructure required. Are development financial institutions and venture capital and private equity firms willing to provide patient capital to these earlier stage health tech companies? The question is being asked because most investors prefer to go to companies which have already begun to be profitable, and health tech gets left out given its longer gestation period. Maybe I'll have Jenny take this one, because she invests quite early stage where businesses burn a whole bunch of cash before they have the opportunity to turn profitable. I know that's true with Sapna as well, but Jenny's definitely, she's investing pre-revenue, so there's no way they're profitable.
Yeah, what are revenues, right? So
yeah, that's right.
No, look, we're a life sciences venture capital fund, and oftentimes we're taking very, very early stage clinical and technology risk before an FDA approval or a CE mark and whatnot. But we're also fiduciaries, and we have IFC as one of our largest LPs. And so when we think about the risk reward trade-off and the time to liquidity, we take that into account when we're crunching our numbers or doing our models. So if we anticipate a quicker return, we may have a different internal threshold as to what the IRR needs to be. But I think when we're thinking about a longer dated investment, the risk reward paradigm and the time paradigm have to make sense for us. So I think by definition, life sciences is more patient capital, because our paths to liquidity could be 5 years, 6 years, 7 years in some cases, and not the quick 2 to 3 year turnaround time.
Yeah, thank you.
I would just add. Yeah, I would just add on to that. Many private equity funds that are investing on the continent and globally do have fund life restrictions, where they may be only 10 years or something like that. And the first 5 years of that is when the investment period kind of takes place. Those limitations can often put restrictions on the types of businesses that we're able to invest in, just given the mandate, especially if they are longer term. DFIs are oftentimes a viable source of more patient capital that could be useful for some of those types of ventures.
Great, thank you. Sapna, do you have anything to add? I will just throw in IFC. So IFC has directly or indirectly 2,000 investments in disruptive tech across emerging markets. I can count in two hands the number of those that are profitable from a cash flow perspective today. Most of them are having substantial revenue growth, but they're still reinvesting in their businesses. And so that's part and parcel of also being a patient capital. So a DFI can actually invest in businesses that we hope and believe will ultimately break even and turn profitable, but we're doing it well before that. So the final question I have for you is, we have a bunch of entrepreneurs on today's call, many of which are looking for funding to expand their business models into either adjacent geographies, further create depth and moats around their businesses. What do you look for when you guys are making an investment, both in the business model the quality of the entrepreneurs involved. What does good look like that gets you to the point where you and your respective investment committees say, yes, I'm going to invest? Sapna, do you want to kick us off?
Yeah, I can start. So because we're a venture firm, we're willing to take that early stage risk. But the way that we think about it is you have to have already sort of proven that there is some sort of demand for your product. So it's that product market fit in the early days. So we don't invest in just the technology, unlike Jenny, that might take years before you can prove that there's demand for it. So it's really business model innovation that we're looking for. From an entrepreneur perspective, that's actually really, really important for us, because when we're investing early, there's not much to assess in terms of the business model. There's not much track record. We're investing in the entrepreneurial team. And what we're looking for in the entrepreneurial team is, are you solving a big problem, a huge problem that is sort of there for majority of the population, which means that you can then scale if you figure it out. And on this continent, majority of the population is low income. So inherently, you have to be solving that problem for a low income consumer, not a wealthy consumer. And from an entrepreneur sort of perspective, it's, how much are you willing to put in terms of blood, sweat, and tears to make this work? How ambitious are you? How big do you want this to grow? There's no right answer, but it's finding the right investor that fits with what you want as an entrepreneurial team. Yeah, let me pause there. Those are sort of the more qualitative things that we look for rather than quantitative.
Jenny, how about you?
Yeah, I think amazingly, Sapna, I totally agree with you. First and foremost for me is the CEO, the leadership team, and the ability to attract talent. Because yes, of course, Adjuvant invests in technologies and we invest in science. But while there is a black and white answer sometimes as to whether or not something works or not, the team behind the blocking and tackling and the experimentation and working with the requisite regulatory authorities to get to that approval is extremely, extremely important. And so whenever I look at investments is, yes, of course, you have to check the box on all the science and the clinical stages and whatnot. But for me, it's the team, it's the leadership, it's the CEO and the leadership team's ability to take feedback and to grow and to evolve.
And Michael, you do everything from earlier stage health tech to later stage big traditional health. What do you look for when you're seeking to make an investment?
Yeah, I think Sapna and Jenny did a great job of kind of outlining the big areas. I would say a little bit, obviously the team is very important, as they discussed. Is there, I would work to show a track record of entrepreneurial success. Is there critical expertise in some of the areas like technology, operations, marketing, risk management, and also coachability? So, a lot of companies are going to go through challenges, and some may need to pivot at some point. And so investors generally want to work with the team that's nimble, open to advice, and coaching. On the market, I think understanding the market opportunity, competitive landscape and whatnot, and then how you're differentiated, like what makes your business special, and how you're actually going to compete with all the players that are actually in the market is super important. And then last is, I would say kind of on the growth plan and traction. So, what are the major milestones as you look forward, potentially for various rounds of investment and whatnot? And then how much capital do you need for those various milestones, and what will it be used for? So kind of a uses of that cash that we would invest. I think if you're able to highlight those things and really bring them out, I think it would be extremely helpful.
Well, thank you all. I want to personally thank our panelists for taking time out of their days. So Jenny, Sapna, and Michael, thank you for participating. And thank you also for respecting the importance that IFC believes in the diversity of decision-making amongst investors. And so You've been key and important parts of developing that impact, which I think is going to inure to better returns for people like us that invest with you going forward. So we heard a lot today from our panelists. I hope it was useful for the audience. I know this is the closing session of this day's events for TechEmerge, but I encourage you to visit all of the tech company booths. You know, we have 50 startup entrepreneur innovators in the booths from 20 countries. They're all seeking to leverage their ideas and innovations to solve some of these tech challenges and hopefully move us closer to this universal coverage, public-private partnership, tech for good, and nirvana of leapfrogging US or Western European healthcare quality standards at much lower cost in places like Kenya, Uganda, and Ethiopia. Really appreciate everyone's attention today, and thank you all.
All right,
Thank
thanks
you.
everybody. Thanks, Bill.
Bye.
Bye.